and welcome to the Susan G. Komen, Kansas and Western Missouri broadcast. This month, we've asked you to take action. We have also asked you to change the way you think about October. Instead of focusing our work on one event, one day out of the year, we've changed our mindset to be impact driven. Everything we do centers around ending breast cancer forever. Today, you will hear more about our paradigm shift to respond to our region's needs toward achieving our mission. We are sad to not see you in person and share in the celebration that you have come to love over the past 30 years. I look at this moment as an opportunity for us to change from an event-focused organization to a world community leader, fostering partnerships, strategies, and outcomes that will save lives for years to come. Take a moment now and listen to NCI designated, the University of Kansas Cancer Center Director, and my personal hero, Dr. Roy Jensen.
Hi, I'm Dr. Roy Jensen, Director of the Cancer Center at the University of Kansas. And it is my pleasure to talk about the strong relationship that we have with the Komen chapter here around Kansas City. We are so blessed to be working with this group to fight breast cancer. And I just wanted to tell you a little bit about my personal commitment to this organization. I've been involved with Komen since the early 1990s. And this was with the Nashville chapter at the time. And in fact, at one point, I was the race refresh chair. And that is a special phrase in Komen speak known as the person responsible for cleaning up all of the trash at the end of a 5K race. And believe me, it was my pleasure. I've always felt that it's critically important for cancer researchers and clinicians to be involved with patient advocacy groups because they have so much to teach us. And that remains true today. And we're so blessed to have the support of the Komen organization. And we have had a number of our Cancer Center faculty, including Carol Fabian and Danny Welch, serve on the National Komen Board. And you also know Cheryl Jernigan and Peggy Johnson, who have been involved with Komen National for many, many years. And they are a great blessing and resource to us as they guide our Cancer Center program. And I just want to wish this year's event all the success possible, and we look forward to fighting this disease together. Thank you very much.
It is my distinct pleasure to introduce my dear friend, Cynthia Newsome. As most of you know, Cynthia is a beloved midday anchor for 41 Action News. Unfortunately, she knows all too well the impact breast cancer has on a person. In 2011, she was diagnosed with breast cancer and then had a recurrence just last year. Throughout all of this, throughout all of her treatment, she continues to work, thrive, and most importantly, inspire others. We are so lucky to call Cynthia a good friend.
All right, thank you, Erica, for that great introduction, and hello, Komen family. As Erica said, I'm Cynthia Newsome, 41 Action News anchor, and I'm going to be your host for this evening. Susan G. Komen, Kansas and Western Missouri has helped support communities across the entire region, and although we are certainly spread out, we work together as one to end breast cancer forever. Let's take a look at some of our partners, supporters, and survivors who make the entire Komen, Kansas, Western Missouri affiliate thrive.
My name is Daniel Craig, and I'm the Cancer Outreach Coordinator at Tammy Walker Cancer Center in Salina, Kansas. I have the privilege of working with Susan G. Komen, Kansas and Western Missouri through my work at Tammy Walker Cancer Center and through statewide organizations I'm a part of, including the Kansas Cancer Partnership and the Kansas Public Health Association. Last year, Tammy Walker Cancer Center was one of the host sites for the Susan G. Komen, Kansas and Western Missouri and Masonic Cancer Alliance statewide listening tour. The listening tour enabled us to identify some of the challenges as well as the resources available in our community when it comes to cancer prevention, cancer screenings, and cancer treatment. The COVID-19 pandemic has created a lot of challenges for all of us this past year. We have found that we need to be more creative and utilize technology, including Zoom and Facebook Live, in order to engage community members in cancer prevention initiatives and cancer screenings. We appreciate the resources and the toolkits that have been developed by Susan G. Komen, Kansas, and Western Missouri, and we appreciate all of their support in helping us to plan our community initiatives around Breast Cancer Action Month.
My name's Les Eck. I'm from Haven, Kansas, town of about 1,000 people, up by Hutch. Grew up basically in a farm town. You know, it's about all I've ever known, farming and car business.
You own Rusty Egg Ford, right?
Yes, I own Rusty Egg Ford. It was started in 1953 by my father, and 1997 ended up buying it from him. When I bought the place in 1997, Komen had come to us and had asked for some help. We were trying to get more people and this and that. And we, you know, being in the car business, we're always pretty good at marketing and so on and so forth. And so we offered to start helping them. You know, the breast cancer just, it kind of struck home because, you know, it affects women primarily. And, you know, everybody has a mother, and to be able to help someone's mother or help someone that has given so much to us through motherhood, it was a cause that just hit home. It's just good philanthropy. It's a cause that you can feel good about. You know, Ford Motor Company's a big sponsor in the race and the Komen organization. You know, the Midwest Ford dealers stepped up and helped out tremendously. I think within the next 5 years, I'm hoping that they will maybe not come up with a complete cure, but something that really puts a dent in it. You got to keep fighting it. You got to keep raising money. You got to keep doing it, good times and bad, and that's the hard part. Life doesn't end. You know, it continues.
My name is Chantrice Patillo, and I am a breast cancer survivor. 1 in 8 women will be diagnosed with breast cancer. However, African American women will die at a rate that is 40% higher than her Caucasian counterparts. African American women are often diagnosed at a later stage when treatment is limited, when treatment is costly, and the prognosis is poor. African American women tend to have more aggressive forms of breast cancer. Susan G. Komen is dear to my heart because of its mission to achieve health equity, where everyone has full and equal access to health care. And it Speaks Truth to Power initiative, which is an advocacy program aimed at decreasing social determinants of health and decreasing occurrences of breast cancer in African American women. The program provides African American survivors the platform to become advocates in their own community. In addition, these women have the opportunity to advocate for others among their legislators on a local level, a federal level, and a state level. These women advocate for issues such as breast cancer research, Medicaid expansion, and to reduce barriers to treatment. It took medical professionals 4 months to provide my diagnosis. I had to advocate for myself because my breast cancer presented itself as pain in my right breast. Medical professionals told me that pain is not associated with breast cancer. However, pain can often be associated with aggressive forms of breast cancer. Where you live should not determine if you live. The color of your skin should not determine if you live or die from breast cancer. Health equity is achieved when all have access to quality health care, regardless of the color of your skin or your social economic status.
Hi, my name is Dr. Amy Patel, and I'm the Medical Director of the Women's Imaging Center at Liberty Hospital. Here at Liberty Hospital, we are so proud to partner with Susan G. Komen, Kansas and Western Missouri, because it takes a village in the fight against breast cancer. This month, we are renaming the month not Breast Cancer Awareness Month, but Breast Cancer Action Month. We are encouraging you to take action to get in and get your mammogram. Unfortunately, with the pandemic, we are seeing many patients who are delaying life-saving screenings or just decided not to have their mammogram altogether. We know that screening mammography saves the most lives and life years saved, so it's so important not to delay these life-saving screenings. Together with Liberty Hospital and Susan G. Komen and various other organizations in the community, we are encouraging you not to delay these screenings so that we can save the most lives possible. Thank you.
Thank you to the individuals in Kansas and Western Missouri who are working to achieve Komen's mission to end breast cancer forever. We know there are plenty more of you out there tonight doing the very same thing. Of course, tonight's celebration should focus on the most important thing, and that is you, the survivors, the supporters, and the people who are working tirelessly to fight breast cancer. Without your commitment to sharing your stories, the impact we make would be impossible. I've been very public with my personal breast cancer story. I'm currently battling metastatic breast cancer at the University of Kansas Cancer Center. Treatment is going well. I'm strong. I feel good. I'm still working. My tumors are shrinking so far. It's a long-term battle. This is my second battle with breast cancer. I was a 7-year survivor before I was diagnosed with metastatic breast cancer, and Komen was there with me for both battles. They're here with me now as well, so I appreciate you and thank you for that. Now, let's hear from some of the strong, inspiring breast cancer survivors who were brave enough to share their stories.
Dr. Allison Banikowski is a 10-year breast cancer survivor from Olathe, Kansas. Although she had breast cancer, Allison considers herself fortunate. Fortunate that she was able to have great health insurance, which allowed her paid sick leave. Fortunate to have supportive friends and family who would take her to doctor's appointments and send cards to cheer her up in her time of need. Most importantly, that she can call herself a survivor, which she does not take lightly. Her advice to anyone who has been diagnosed with breast cancer is to surround yourself with knowledge and to spread that same knowledge within your support groups. Let others know about your diagnosis. There is grace in allowing others to support you. Jill Phillips is a breast cancer survivor of 5 years from Lincoln, Kansas. Her battle with breast cancer has given her a more meaningful perspective on what is and is not important in life. She has a newfound courage and optimism which allows her to face challenges head on. She is fearless. She found the strength and bravery from knowing that she is not alone. Support is crucial for breast cancer survivors, and Jill was able to find hers from her family, friends, and community, and even within treatment rooms. This inspired her to share her story publicly in the newspaper, which she found was not only helping others, but was also very therapeutic for her. Jill's story was also so admired that she received an award from the Kansas Press Association. For new breast cancer patients, Jill has 5 essential pieces of advice. 1. Find a team of doctors you are comfortable with and can trust. 2. No matter how bad you feel, remember this is temporary and you are not alone. 3. You may see a decrease in your stamina. Do not hesitate to ask for help. 4. Get your fight on. And 5. Count your blessings every single day and focus on the positive. Mary Lee Bataya is a breast cancer survivor of 19 years from Basehor, Kansas. To her, being more than pink means to seize each day. Let the wind blow and mess up your hair. Her strength comes from her daughters, girlfriends, and her ability to work with children. Her support, however, comes from having a team of doctors she trusts who communicate well with Mary Lee and each other. Mary Lee urges breast cancer survivors to give back. This could mean supporting the fight against breast cancer financially or even mentoring a recently diagnosed individual. Let them know that you are open and welcoming to their questions. Lastly, she wants everyone to know that sharing and advocating go a long way. It's up to us to ensure those who are diagnosed with breast cancer get the help that they need. Heather Wright-Rennick is a breast cancer survivor of 8 years from Cimarron, Kansas. She says having breast cancer was life-changing, but her experience carried some silver linings. Some of her biggest blessings are due to her breast cancer diagnosis. She tries to live more fully, laugh more frequently, and love more deeply. Her most prominent support came from being connected to other breast cancer patients. Heather mentioned that nobody understands the journey better than someone that's already been there. Her strength came from the things that mean the most to her: family, friends, work, community, school, and faith. She is encouraged each day by how far we've come with breast cancer research and treatment, and cannot wait to see how much further we will go in her lifetime. And for anyone who has received a recent diagnosis, take it one day at a time. Spending today worrying about tomorrow makes you lose the joy of today.
This month, we've emphasized the importance of taking action. Awareness isn't enough anymore. We need to put our words into motion. I am asking you to take action for yourself, for a loved one, and for future generations to come. My call to action to you is 1, vote. Public policy has the potential to produce the largest ROI toward achieving our mission to end breast cancer forever. Early voting is taking place right now. I encourage you to put a plan together and vote in this election. Secondly, if you are 40 and above, please schedule your screening mammogram today. We know that early detection saves lives, and that begins with getting a screening. Encourage your mom, your loved ones, your neighbors to schedule their screening mammogram today. Third, please consider getting active. We know that physical activity helps improve health outcomes. Do something to stack the odds in your favor by being active. Go for a walk, run, ride your bike, do something outside, get active today. This call to action is really bolstered by the incredible leadership of our board of directors. It is now my pleasure to introduce our board president, Richard Winston.
Hello, my name is Rick Winston, and I am president of the board of directors of Komen, Kansas and Western Missouri. Over the past year and a half, the Komen, Kansas and Western Missouri board of directors have shifted our investment focus to be responsive to our region's needs. With every decision we make, we must produce the highest impact because so many of you are counting on us. Our focus has shifted to 4 priorities. Number 1 would be access. After many community discussions, we determined that our Kansas City Metro and Sedgwick County, Kansas areas needed a solutions collaborative to create a seamless structure for the continuum of care for women. This means we have launched a solutions collaborative in each area with partners that include radiologists, community healthcare workers, and practitioners to understand and establish a workflow that ensures a woman is taken care of from the screening to her survivorship. 2, advocacy. We were very engaged in this past year to expand Medicaid coverage in the state of Missouri to ensure more women are covered to receive preventative and follow-up care. Engagement in public policy produces the largest return on investment toward meeting our mission to end breast cancer forever. 3, health equity. We know that in order to achieve our mission, we must prioritize health equity. This year, we launched a breast cancer health equity task force to address screenings, discrepancies in treatment, better representation in clinical trial participation, and other issues. For example, African American women are 40% more likely to die from breast cancer. This is an unacceptable statistic, and we are working to lower it. And finally, and probably most importantly, item 4 is partnerships. We know we can't do this alone. By bringing others to the table, we can achieve more and save time and resources. This is why we participate in the Kansas Cancer Partnership and the Missouri Cancer Consortium in leadership roles. This investment shift, we believe, will achieve more towards our mission and is the best stewardship of the incredible commitment by our community. We greatly appreciate your participation and support of the 2020 More Than Pink broadcast. Thank you for all you do.
In 2020, an unprecedented virus unexpectedly shut down the whole world. Though it stopped many of us from working, learning, and visiting our loved ones, it didn't stop breast cancer. During the months that COVID-19 halted our world, women and men were still being diagnosed with breast cancer, receiving breast cancer treatment, and some were still losing their fight with this disease. Due to the current outbreak, this year we cannot gather for the More Than Pink Walk to raise money and awareness for breast cancer research.
But that's not stopping Coleman or me!
Teresa is pledging to be more than pink. She pledges to walk, eat healthier, and be more active. 3 things proven to reduce the risk of breast cancer. Between August 1st and October 24th, she is pledging to lose 20 pounds. And for every pound she loses, Teresa is asking you to pledge just $1. With your help, we can reach our goal of $2,000 to fund breast cancer research and find a cure. Help her to be healthier, thinner, and help her to end breast cancer forever. Together, we can be more than pink.
Fighting breast cancer is not easy. It takes patience, determination, love, and support each and every day. But it also requires investment. So to those who have worked night and day to help drive impact, know that you are truly saving lives. Now, because we could not be with you in person this year, we have introduced a new initiative to walk where you are. We use the hashtag Walk Where You Are. Now, whether that means taking a walk in your neighborhood or pledging to get back to health, you can take action in your own backyard. Show us how you hashtag Walk Where You Are on social media and let us know who you're fighting for. Now, tonight we want to recognize the individual who walked the most, along with our top fundraisers. And this includes the top corporate teams, other teams, and individual fundraisers for the Coleman, Kansas, and Western Missouri More Than Pink celebration. This is a time to acknowledge those who raised the most dollars for tonight's event. So let's take a look at the leaderboard to see the impact of your incredible fundraising efforts. A major congratulations to all of our top fundraisers. We love you. You have done life-saving work. Thank you so much for your efforts. Now, please join me again in recognizing everything these top supporters have accomplished. Now, back to Erica Terry, Coleman, Kansas, and Western Missouri's CEO.
From all of us at Susan G. Komen, Kansas, and Western Missouri, thank you for joining us tonight. Looking to the future, we know we have a lot of work still to do. The impact of COVID will be felt for years and years to come, and we ask you to join us 365 days a year to help us end breast cancer forever. Be proactive with your health, encourage others to get their screenings, and join us in advocacy efforts to ensure everyone has access to care. It's going to take a lot of work, but we know we can do it with your support. Thank you so much and have a wonderful evening.